Welcome to the webinar, everybody. This is going to be a webinar on managed care readiness for child-serving organizations. Feel free to hang on for a couple minutes while we let others log in, and we'll get started in probably 3 or 4 minutes. Thanks so much. To log in, then we'll get started. The webinar on moving forward managed care readiness for findings for child-serving organizations. Today we're going to talk about the managed care readiness assessment that many organizations around the state have completed over the last year. We're going to be talking specifically about the children's organizations that have completed that assessment, and even more specifically about the OMH and OASS providers. We've also done an addendum that included OCFS and child welfare providers, and while some of them cross multiple categories, obviously, unless they cross those multiple categories, their data isn't included in the presentation today because we've already covered that in another forum. So if you're an OCFS-only agency, you can refer back. It's on our CTEC-NY website for the readiness presentation that we did on the OCFS-only data. So we're going to talk a little bit about what the readiness assessment was. Now, briefly, I'm going to just discuss what CTEC and MICTEC are, but we'll speak a little bit about kind of what the readiness assessment is and was, and we'll go through briefly some of the results that have come out of that globally. Also, some of the addendum results, that are specific children's addendum results. We'll talk a little bit about the benchmarking report that if you completed the assessment you should have received by now, and then also talk very briefly about kind of next steps in terms of technical assistance for children's child-serving organizations in New York State kind of going forward into next year. So let me talk just very briefly about the Community Technical Assistance Center of New York as well as the Managed Care Technical Assistance. So the Community Technical Assistance Center in New York actually started working with children's mental health clinics in 2011 and has since expanded to include a much broader array of technical assistance, particularly focused on particular types of programs that are undergoing significant amount of changes, as not only as we go towards this managed care change, but also as we just kind of, as the system kind of changes over time. So we not only work with all mental health clinics in New York State, but we also work with all OCFS child welfare agencies, residential treatment facilities, and family support agencies. So we really kind of cover a larger swath. But I really view the work that's being done at the Community Technical Assistance Center at a program level, particular types of programs within agencies. The Managed Care Technical Assistance Center is really focused on working with all mental health and substance use agencies in New York, both adult and child-serving agencies in New York, really focused on helping them make this transition to managed care. And I think that's really a critical transition that's happening in New York State for adult providers in New York City, in particular in like 3 weeks on October 1st, followed the rest of state in June, but then it's going to be affecting the children's system in January of 2017 at this point for New York City and Long Island, and then in July of 2017 for the rest of the state. And so we're going to be offering a similar transition support for all children's providers. We've opened much of that up for children's providers that we've done this year, and so for those of you who've kind of been on the ball already and participating in a lot of that stuff already, you've probably done some of that, but we'll be offering more in-depth training and also kind of the broad-based training again for all child-serving organizations from both OASS, OMH, and OCFS in the next year. So we're really looking forward to that, and more details will be about that, but I'll talk a little bit about that in a couple minutes at the end of the presentation, just to give a very, very brief preview of some of that information. The other thing I'll just say today as we're getting started is that throughout the presentation, as you have questions, feel free to chat them in the chat box. And I will do my best at the end of the presentation once we've kind of gone through the presentation to get through as many of those questions and answer as many of those questions as possible. So just a little bit briefly about the Managed Care Readiness Assessment. It's an online survey. It really was designed to help agencies start to think through their level of readiness for this transition to managed care. It was designed originally to work with kind of all mental health and substance use providers, although we've now added a child-specific addendum, which we'll talk a little bit about today, and also a child welfare addendum which we have talked about in other forums, and most child welfare agencies at this point have completed the child welfare version of this. The goal of the readiness assessment was really not only to provide us with data in terms of helping, in terms of where the areas of most need were around the state for technical assistance, but also very, very much to help agencies think through what are the areas in which they're strongest, what are the areas in which they're weakest, and what are the areas in which they're going to really need to focus their efforts on over the next year as they prepare themselves for managed care. And I think just to give by way of background, the readiness assessment was really started out, the development was started out by CCSI, and they had used it in some Western New York areas in a much earlier form. And then we really expanded upon their existing readiness assessment, added in a bunch additional content, but then really vetted this through all the state agencies, all the state agencies, all the state agencies, New York City, several managed care plans, the plan association, several providers, as well as some other folks as well. So it really does represent a consensus view, a pretty consistent consensus view of what agencies actually need to do in order to prepare for managed care readiness. And one of the things we recommended in the completion of the readiness assessment, and I want to just highlight this again because even if you've completed it, we really think this is a good structure for you in terms of the work that you're going to be doing going forward to kind of think through how you prepare for managed care. So what we really hoped was that when people completed this readiness assessment, they just didn't send it to somebody in their office to fill out and send in, that they really pulled together a team of their senior administration, their senior program people, their senior finance people, their IT people, and any evaluation people and QA people on their staff to really think through as an organization where they are in terms of readiness, because no one individual, even at the CEO level, has all of this knowledge in their head. And so really the idea was to draw upon the different levels of knowledge across the organization to complete the readiness assessment, with the idea that what we really hoped to do was to facilitate, for this to start a process within an organization to help that agency start to engage in developing a readiness plan with which they can really get their agency ready. And that process, while it does require somebody to be in charge of it, it is not a process that can be done by one person or one portion of the agency. It really is something to make sure that you have all the different pieces of the agency really kind of working on this. And one other thing that we're really starting to notice is there is oftentimes a gap between the knowledge that is had at the upper level of the agency in terms of what's happening, when these changes are happening, what the changes are going to be, and those kinds of things. And also down lower in the agency, but at the frontline staff, but even at the middle management level, where oftentimes the staff are not aware of these changes yet. And so I think one of the things that we're really starting to encourage providers to do is to start to make sure that that information is getting disseminated further and further down into the organization. And at the end of the presentation, I'll talk about a couple things that agencies can do and a couple resources that we have available for folks to do that. So the Managed Care Readiness Assessment is made up of 11 domains, and I'll talk through what each one of those is. And it really is designed to give people a snapshot of their current level of readiness, and also the areas where they may want to really focus on their technical assistance and really really kind of build out the areas of TA that they're going to need. So we have readiness assessments from 276 child-serving organizations. That includes all the OCFS agencies that have submitted. About 60% of those organizations get the majority of their reimbursement from Medicaid, and then actually about a third of organizations say they actually get about less than 10% of their revenue from managed care at all. And we're going to look at, when we talk this through, we're going to look at actually the differences in reimbursement rates and how that affects readiness scores. And I'll talk briefly about some of the things that we at MCTAC and CTAC are going to do about that. Okay, so about 116 organizations were OMH-funded child-serving organizations. 36 organizations were OASAS, and I know that on the OASAS side, there is OMH kind of designates children as agencies as child providers and adult providers separately. On the OASS side, it's a little less structured that way. So I imagine that there's also a number of organizations in here that aren't reflected as OMH or OASS, but that may also serve clients with substance use. And then 87 agencies who completed the OCFS assessment, and then 43 agencies that actually kind of viewed themselves as outside of that, and they may fit into this. One of the other things as we kind of go through the beginning of the readiness assessment is also just to highlight that this is all self-report data. And so, you know, as an internal tracking tool for you, it's going to be incredibly helpful to help you as an organization think through where you need to go in terms of your readiness for the transition to managed care. And for us at a global level, it's also really important for us to help see where agencies are. But one of the things that we're really mindful of is it's all self-report data. That data is based on people's perception of their level of readiness, and that perception may not always be entirely accurate. So that perception may not always be entirely accurate. As agencies learn more, they may realize they had holes in their readiness, and they may also realize that they were better prepared than others. And I think one of the examples is one of the agencies that we know very well, you know, has scored lower on the readiness assessment than we would really anticipate them to do. But that's because they've been working on this for a couple of years, and they really do know where their weaknesses are and where the areas that they know they still have work to do. And so I think, you know, you kind of have to view that with a bit of a grain of salt. But I think globally, when you look at the level of readiness, we see a lot of consistency across providers. And I think it does give us a really good idea of kind of where the state is in terms of their level of overall readiness for this transition. Okay. So before we go into the domain scores, I just want to kind of walk through each of the 11 domains, and I'll do this quickly. One is understanding managed care priorities and the present managed care involvement. So it's, you know, how involved are you with managed care already? Do you currently bill managed care? Do you understand kind of what managed care is? Do you have kind of a general concept of that and those kinds of things? The second thing is managed care contracting. How familiar are you with contracting with managed care companies? Do you already have contracts with managed care companies? Do you understand some of the basic building blocks of contracting with managed care? The next domain, the third domain, is really around communication and reporting. So do you as an organization know how to get service authorizations? Do you know how to share information with your managed care organizations? Have you done that before? Those kinds of issues. Number 4 is IT. Do you have an electronic health record? What's your knowledge of that record? Are you connected to a RIO? All of those kinds of critical IT things are going to be really important as we move forward. And the next one is level of care criteria and utilization management criteria. I think that the utilization management criteria is a really important function. I think we've often done UR and utilization review to meet, you know, OMH or OASS requirements over the years. I think as we move forward in this managed care environment, level of care criteria, utilization management becomes a whole different way of managing your population. And for organizations that aren't as familiar with managed care, that's going to be a little trickier than others. Member services, grievance procedures, all that other kind of stuff is the 6th domain. The one that we see a lot that people do feel the most comfortable with is this kind of understanding of kind of physical health, behavioral health, social support, and health homes, because this is all stuff that we're already doing. That doesn't mean there's not a lot of room for growth in those areas, but that while there is a lot of room for growth, it's an area that at least we understand the concepts, at least we're more familiar with the concepts, and may have engaged in some of those activities. Quality management, quality studies, and incentive opportunities is really this ability to understand and manage quality within your organization. Finance and billing is pretty self-explanatory. Do you feel comfortable billing managed care? Access requirements really around getting access to services for your clients. And then demonstrating impact and value is this really critical element around whether you are set up as an organization to demonstrate your unique value to a managed care company. And that goes beyond just saying, like, we provide really good services. It's how do you actually demonstrate those services through data and evaluation? How do you monitor that internally? And then how are you going to be able to externally project that in a way that's going to really make you competitive going forward? Okay. So we scored this on a Likert scale. So a 1 to 5 scale. One being, I have no idea what these concepts are for each question. I have no idea what this is, and I need a lot of help. And 5 is, I am totally ready for this and really don't need any help. So our global score was right around 3, which is kind of where we would expect, right? So it was right around 3, and 3 is kind of like, I have some familiarity with these concepts, but I could really use some help in these areas. So people, and what we saw here is that people generally had some familiarity with the managed care priorities, but they could still use some help. There's nothing in here that showed that people were like, oh, no, we don't need any help at all. And contracting, IT, the interface with behavioral health, and those kinds of things people really felt pretty comfortable with. But the areas that people struggle with the most, and we have seen this consistently in all the various iterations of this, are communication, so dealing with service authorizations, those kinds of things, which makes a lot of sense because people aren't used to necessarily having all those conversations with managed care, particularly when you get outside of like the OMH clinic setting where there is, more familiarity with managed care. The issues around level of care criteria, again, it's a similar issue. How do you manage utilization management? Member services, how do you deal with grievances? And then these issues of quality and evaluation are really critical issues that as we move, especially as we move beyond the initial implementation into managed care and start to move into value-based payment arrangements, are really going to be critically important for agencies as they start to think through how do they demonstrate their unique value in a managed care world. So one of the things that we know is there's we have a lot of provider protections built in on the front end around the ability to the managed care contract providers are going to be required to contract with many providers who already have existing managed care clients, but that does not continue indefinitely. So after a period of a couple of years. And I think the initial period is 2 years, but after that initial period, then managed care is going to be able to choose which providers they want to work with, and they'll make those decisions based on quality outcomes and the things that they start to see. So, so one question that just came in, I'll just highlight. This is not only just for health homes and mental health clinics. This cuts across both. And actually, we did not poll exclusively health home agencies, although many child-serving agencies are also health homes. This really cuts across both mental health and substance use agencies in the data that we're presenting today. I will highlight that many of those agencies also serve adults and also serve a child welfare population, but we're focusing on agencies that at least serve a mental health or substance use population. Okay. So let me kind of look at some of the group comparisons. We did see some significant differences across regions, and this is something that was different than what we saw when we looked at a more global pool. So when we include adults in this pool, adult serving agencies, these differences kind of go away, and there really isn't any differences across regions. So I just wanted to highlight that there were some differences across regions. There were some differences across regions for for New York City versus non-New York City-based agencies. And so you'll note that the combined totals is, right around 3.5. But on some of these issues, the non-New York City agencies actually did a little bit less well than the New York City-based agencies, which is what we would have expected, actually, just in terms of because some of the larger providers are in New York City. But we didn't see those differences on the adult side, so we just wanted to highlight that as an area that we may want to look into in more depth. I'm going to skip through this relatively quickly because I want to get on to the next piece of this. So this is the data that we really want to focus on. Is this agencies that bill a larger percentage of their existing billing is already in managed care versus those that really have very little to no experience billing managed care. Now, they may bill Medicaid already, and they may bill fee-for-service Medicaid, and that, at least establishes a standard around billing and those kinds of things, but they're not currently billing very much managed care. And what we noticed in these slides and in looking at the data by this cut is what we really noticed is that there is a really significant difference in terms of the level of readiness for agencies that either bill managed care already versus those that really don't bill very much managed care. And so for those agencies that really don't bill much managed care, we're noticing that they really are reporting that they are not as well prepared, kind of across domains. So around managed care priorities, it's about half a point, but we're looking at a full point when it comes to contracting, which makes perfect sense, right? Because if you just bill fee-for-service Medicaid or have just contracts with the state, you have no familiarity with managed care contracting and all the nuance of that. So, and when you come to communications and service authorizations and those kinds of things, you see it pretty consistently there. When you get to the interface between health, behavioral health, and primary care, actually you don't see much of a difference there. And again, that makes sense because those are issues that people have had to address outside of managed care. And I think the other reason that even though we see a difference here between on the quality and evaluation thing, I actually don't think it's quite as big as some of the other differences. And I think the reason for that is that actually, so rather than like a full point difference, rather than a full point difference, it's more like 3/4 of a point. And I think one of the reasons for that is that I think everybody's struggling with this issue of evaluation and demonstrating outcomes, even if you are familiar with managed care. And so I think that it's just really a critical issue that we're all going to have to kind of work through. So if you're one of those agencies that already bills a lot of managed care, I would say that you're probably, and the data bears this out, probably more ready for this transition than others. But I would also raise a couple important points for you to consider. Is that you as an organization are more ready, and you at certain parts of your organization are more ready. So if you have mental health clinics, they're probably more ready for this transition than others. But what we've also found is that agencies that are larger agencies, and some of their programs have been billing managed care, and other parts of their agency haven't been billing managed care, is sometimes that knowledge does not automatically transfer across program types. And so if you were to just do this for the parts of your organization that didn't bill managed care, you might find that same gap in knowledge. And so you have some built-in advantages in that you're already billing managed care, but you're going to really want to work closely to make sure that you translate that knowledge and disseminate that knowledge around the rest of the organization so that you don't have one part of your organization that's really ready and another part of your organization which really isn't very much ready at all. So the ability to kind of have folks draw on the information from the other parts of the organization, I think, is really going to be critical. So if you're one of these agencies that completed the readiness assessment and you know you fall in this blue bar, which shows that you're significantly less ready, I would strongly recommend that as we start to move forward, you start to participate in all the CTAC activities and the MICTAC activities, particularly around the areas of contracting and some of these kind of more building block areas of managed care that you're really going to need TA on. I think it's going to be very important for the other folks to participate in that as well. But if you're one of these folks in the blue bar, you really need to start signing up for this stuff when it becomes available. But I also want to highlight that one of the things that we've recognized as we've done work with the adult system and as we're thinking through on the kids system is that we really are going to try to spend some time thinking through, and we're developing we're about to launch an initiative on the adult side, and we'll be launching a similar initiative on the kids side next year to really work with small agencies. And when we think about small agencies, it's not so much small in size, it's small in familiarity with these managed care and billing practices. So we will be offering some extra technical assistance just for organizations like you. Because what we're discovering is if you think about it as a college model, our TA doesn't necessarily start at like, Psych 101. We're really starting at like Psych 301, which is a couple levels up from there. And so oftentimes the smaller providers or providers who aren't familiar with some of these concepts, some of it takes a little longer to sink in, and that's totally normal because there's just a lack of familiarity with these concepts. And so what we're going to be able to do, I think, in the next year for kids providers is for the providers who don't have the level of familiarity with managed care to offer them some more intensive support to really help all of you kind of get up to speed. And make sure that folks, benefit as much as possible from the technical assistance. So I would just keep your eyes out for that. You'll receive individual targeted support, or not targeted support, but targeted outreach for those kind of practices when we get to that point, probably sometime next spring. but I would be very aware of that and make sure that you as an organization sign up for that when it's available, because not only is it borne out in the data here, but it's also borne out just kind of in our experience that the organizations that don't have experience billing managed care really are going to need a little extra help. That help will be smaller in scope in terms of the number of organizations participating. It won't be individual level support just because we don't have the capacity to do that, but it will be more focused and more intensive supports, particularly working with those organizations. So for those of you who completed the Children's Addendum, we're going to highlight a couple things that came out of that addendum today. There's some more additional information in the addendum that we're still kind of working through and figuring out the best way to present, and we'll come back and talk about that a little more in the future. But I just want to highlight some items. So as we make this transition to managed care, there's a number of new state plan services which are going to be available, which are available in some of our previous discussions. We've gone through those, and a number of new HCBS services which are going to be available as part of this transition to managed care. And so we asked through the community, through the child addendum, what organizations were already providing services which were consistent with these. Now, not exactly the same, because the new state plan services and the new HCBS services are still going to be distinct from that. But what kind of organizations, just to get a sense, were offering services that were at least consistent with those services? So we found that about 66%, about 130 agencies are already providing some type of crisis services, some type of community CPST services or psychosocial rehab services. Family peer support is being offered by like 100+ agencies that completed this. Care coordination is obviously very strong and will continue to go up as health homes kick in. Habilitation, skill building services, those kinds of things. And then the agencies that were much less, the services that were much less prominent were things like pre-vocational services, supported employment, non-medical transportation, day habilitation services, and things like that. In addition to that, we also found, and we were really pleased with this data, that 73% of agencies reported that they conduct at least some type of specific screening and use some type of specific screening and evaluation tool in their work, which we were really pleased to see because, it's almost 3/4 of the agencies are doing something. So whether it be the CANS or the SDQ or the CBCL or the BDI or PTSD scale, those are the specific ones that were mentioned by folks, but I'm sure others who answered do other sorts of things as well. And then there were almost, 80% plus of agencies are doing some kind of specific evidence-based treatment model, which we were really pleased to see, including everything from all sorts of variations of cognitive behavioral therapy to motivational interviewing to 12-step programs to family therapy models. And then 86% of agencies reported doing something to track outcomes. And this was a very broad category ranging from satisfaction surveys to more administrative data like ER and hospital use and things like that. But we were really pleased to see that data as well. I think it's an area that there is going to be a lot of growth for in there, but we were pleased to see that some folks, that a lot of folks were doing that, and it was a little higher than we were expected. So we also looked at those same services that will either be new state plan services or new HCBS services, and whether people were doing that in collaboration for others. And I won't go through this in great depth, but it did highlight that a number of these agencies are also doing this in collaboration with others as well. So even if they're not providing the service, they're often partnering with other people to provide the service. And I would just mention that as we go into these relationships with managed care companies, the ability of an agency not only to demonstrate that they can provide the service, but that they're within a network of providers that they work with, that they can provide the service is also going to be critically important. So, respite and pre-vocational services, again, are often offered by others. Now, one of the things that's going to, really serve as a foundation for this new model is really this concept of trauma-informed care. And we were really pleased that the agencies that completed the Children's Addendum around the issue of trauma-informed care really were showing in pretty high percentages that they are familiar with these concepts of trauma-informed care. And just to highlight for folks that we'll be doing a lot more work in this area as we move forward, but we're really, really pleased to see that, almost 75% of people are assessing for trauma and caregivers and kids. Are working with families and being sensitive to children who've experienced trauma. We're really glad to see that these concepts of trauma-informed care have really been infused throughout the KID system, and while we're doing a tremendous amount of more work in this area, at least the general concepts are there already. So one thing I really want to highlight, and again, if there are questions, please feel free to chat them into the chat box, and we'll answer them at the end of the webinar. And I've probably got another 10 minutes or so of talking, and then we can take additional time for questions as we need to. So so every agency who completed the readiness assessment should have received one of these tools back, this benchmarking tool. And so while we don't share any agency's individual assessment data with anybody else, we did want to give agencies the opportunity to see how they scored on this, right? So they can look at how they scored, but also to look at how they score compared to the global average of other folks. So if you look at this first column, the first column breaks down by domain in total an agency's average score. Okay, so it breaks down that their average score there, and then in the next column, I think if I click the next slide, there we go. In the next column, it has I said this wrong, and I did this. I haven't talked this for a while. All right, so this is the average score. The first column is the average score across the state. So the average score across the state in this area. So let's just take managed care contracting was 2.5 around the state. So the average score for the agency that we have here was 3. So they're a little better than the average, but they're in the 44th percentile for the rank. So I think our numbers are a little messed up on this one because it was dummy data. But so it's the average score. And then you can also look at your percentile compared to the rest of the state. So I would strongly recommend that if you completed the readiness assessment, you go back, you look at your benchmark tool, and this is really something to take and go over with that group of folks, who you completed this with. I think it's really critically important that you take that back and go over that with your management team and say, okay, so this is how we scored in each one of these areas. These are areas that we internally are going to focus on. These are areas where we're doing better than the rest of the state, but we still need some help. But then here's some areas where we really are a little behind other providers in the state, and so maybe an area that we need to give special attention to. If you were on the webinar today, you completed your readiness assessment, and you know what? You never got one of these benchmarking tools back, please reach out to mictac.info@nyu.edu, and it's actually on the last slide, so you don't have to write it down. You can just wait till the last slide and then download other slides and deal with it that way. Please reach out to MICTAC at mictac.info@nyu.edu, and we'll track it down and resend it to you, because sometimes people leave the agency, or we would send it to the wrong email address or that kind of thing. We sent out 273 of these things. So if for some reason it's gotten lost in the wash, please let us know and we'll be glad to send you one. The other thing I would also highlight, and you can download from today, is we broke down each of these sections of readiness into some suggestions of things that you can do to start to get ready for managed care. So I'm not going to go through this in depth, but it's some creative sections, some creative opportunities of things that you can start to do to get ready for the particular areas of managed care readiness that are highlighted. So they're not broken down exactly by the domains, but they do kind of cover these broad areas. So please download this. It'll be available with the slides from today, and take a look at this. And then when you're sitting down with your management team and trying to go through this, this is a really good opportunity for you to kind of have some suggestions and think concrete things you can go and do based on the assessment. Okay. So that's what we just talked about now. And again, it's right there, and you can just click on this link, and we'll put it back up on the website, and you'll be able to access that as well. We already talked a little bit about the limitations of the data. And then the other thing is, one of the things that we've done with OCFS agencies around the readiness assessment is really help them start to think through a work plan of, okay, so I got this readiness assessment done. I really thought I got my scores back. Now what do I do? So we've developed a work plan, which is at this point a really pretty basic work plan. but that we really hope that folks could use internally. It might be a helpful tool internally to use to start to think through some of the issues that you're going to need to address based on the weaknesses that you found in your readiness. So you can put your readiness score here. What are the specific things that you're going to do in that area to really kind of improve your readiness? How are you going to measure that? How are you going to measure that area so that you, especially at the executive level, can track whether these changes are being made? Are you going to need additional resources for that? Are you going to need to hire a consultant? Do you need to hire more staff? Do you need to buy a new EHR system? Like, what are the resources you're going to need? And then the funding source. You know, certainly OCFS right now is putting out some funding around funding areas and funding for managed care readiness. I think that, you know, so are you going to have, do we want to apply for grants for that, those kinds of things. So where are you going to find funding for this? And then also, when do you expect it to be completed? So this is a very basic work plan. Obviously, you can develop something that's consistent for yourself or more, you know, better, but we just want to provide folks with something. And also, I think really combining that with these suggested activities can really help you kind of translate the managed care readiness tool into something that will be it'll be really helpful in terms of actual document moving forward, and really a way to track your progress and start to move forward over time. All right. So as I'm going through these last couple of slides, I just want to remind folks that we've gotten a couple questions which I'll answer when we get to the end. But if they have questions, please chat them in now, and I'll be glad to answer questions when we get to the end, because I should be done with the formal part of the presentation in a couple minutes. So we're going to be offering TA for child serving agencies starting a little bit this fall, I think. And then, you know, a lot of TA going forward into next calendar year. That TA, what we're trying to do, because across both CTAC and MCTAC, there are a lot of you fit into a bunch of these different categories, and so keeping track of all this stuff in your head and all the kind of different TA offerings that are out there can actually be a little bit confusing. And so one of the things that we're really trying to do here in the background is really to conceptually start to put these things into buckets for you folks. So I'm just going to preview the buckets that we're working on in the background, and these will become formally part of the way that we deliver TA and the way that we organize ourselves. Probably in the next month and a half or so, is we're going to be previewing a new, putting out a new website. And really, and then the website will be organized around each of these buckets. So one is business best practices, which really includes things like, you know, contracting and revenue cycle management, all those kinds of things. Services best practices around clinical services, so whether it be motivational interviewing motivational interviewing to family therapy training, or any of these kinds of things, that'd be in the services best practices category. Professional development, what are the things that your staff are going to have to do in terms of developing their own competencies, or what strategic planning or opportunities will there be for agencies to kind of engage in a process of strategic planning as they pull this stuff together. And then value-based practices. So when we think about value-based, what we really are talking about is this issue of managing data, measuring your progress, getting ready for a value-based world where we really stop getting paid based on the number of services that we deliver, and start getting paid based on the quality of the services we deliver. And so how do you set yourself up as an organization to really be successful in that world? So those are the four big buckets. And then the other bucket we've added is a service redesign bucket, because whether it be RTFs or opioid treatment programs on the OASIS side, or you know, a variety of different programs. A lot of these programs really as a program are going to change. The type of services more globally are going to change, and it really cuts across all of these other buckets. So we've kind of put a service design thing in here that really will be a lot of activities that are focused on those individual service changes that are going to happen. All right, so I'm going to go through this real quick, but there's some tools that we're really working on right now, and some that are launched already, which we just want to make sure that you take advantage of now, and then take advantage of in the future going forward. The first is our matrix, which I'll talk about in a second, and also our glossary. But let me just skip through these, and I'm going to show you that. So our matrix is live for New York City for adult providers now, and will be live for the rest of the state as we get closer to rest of state rollout. And then we'll add additional information on kids providers as we go forward. But really what our planned matrix is we decided that rather than each agency having to figure out who do you call at Fidelis or any of the other managed care plans, that we would really want to focus on helping agencies have one place they can go and find out the contact information, all the other information they're going to need about any particular managed care company. So what we have is and this is just for New York City right now, but we have all the managed care companies listed by county, by region, and you can look at all of them, and then you can identify and look through the individual data that's associated with them. So, who are you supposed to call for general information? Who are you supposed to call for medical director? It's all in here in one place across a variety of different domains. So while this is only active for adults now, I actually encourage you, as you're starting to build relationships with managed care companies, to look through the matrix, take advantage of the matrix, and just know that as we move closer to the kids rollout, that we will update the matrix to really be part of the kids rollout. The other tool that's up on our website right now that's live and we strongly encourage you to take advantage of is what we call, which is just our glossary. Somebody in one of our early kickoff events stood up in the back of the room and said, please, somebody just put all these terms online and all these acronyms and tell me what they mean. So we took that to heart and we went and did that. So up on our website at mictac.org is our glossary, and you can just not only download a top acronyms cheat sheet, which you can just stick up on your wall, but you can also go through by kind of like alphabetically and just identify whatever I was on this webinar and this Andy guy, he was just talking about all sorts of terms and stuff like that that I didn't understand. Well, you go here and then it'll explain what the term means. So take advantage of that resource as well. There'll be a lot of additional tools coming out as we move forward. So for any further information on MCTAC, please email us if you have any questions about the tools that I've talked about today. Please go to our website at mictac.org for our child-specific stuff around clinical practices and that stuff. Go to ctacny.com. If you, for some reason, didn't get your readiness assessment benchmarking tool, feel free to email us at mictac.info@nyu.edu, and we'll track it down and get it out to you. But take advantage of this website. This website is really, we're building it out as we go, and it'll really become, we're hoping it becomes one of your one-stop shop for all your managed care transition needs. So I'm going to go back through the questions that have come in so far, but if other folks have questions, please feel free to chat them in while I'm talking, and I'll answer them as we go. So the first question that came in was, for child-specific foster care services, will there be one MCO, multiple MCOs per area? There will likely be multiple MCOs per area. I think if you look at the matrix, you'll get a sense of who's going to be live in New York City. And there's 10 managed care companies going to be live in New York City. I imagine that they will also all be child serving. And then around the state, there'll be a little bit of a mix. There are some upstate only managed care companies, and there's some downstate only managed care companies. So I anticipate that those companies, will obviously add in children's services. And then there's some national companies and companies that are in pretty much every state. Or not every state, but every county, and so they'll be active. As we have that information, we will continue to push it out, but I would anticipate that there will be a number of managed care companies present in each region. They definitely are on the adult side, and on the kid side there will be as well. So that would be the assumption I would take in going forward. We can't name the ones on the kid side yet because they haven't gone through any kind of review process, but at some point they will be. And then where did you say the readiness suggestions would be available? In one of the slides, actually, that we talk about it at the top, there's a web link, so when you download the slides, you can click on that link and get there. It's also on our website at mictac.org, and we'll try to make sure it's linked to this presentation as well, so you can get into any of those questions. Would you be able to provide suggestions on organizations to contract with to assist in negotiating managed care contracts? We will be offering specific contracting training starting in the winter. It might be early winter, it might be late winter to early spring, but we will be offering specific contracting training throughout the state. So regardless of whether you are in regardless of whether you are in New York City or rest of state, we'll be offering specific contracting training. We have a fantastic consultant who works with us on that. His services are always available for people who are interested in contracting with him. But you know, I would attend that training first, get a sense of what the global issues are, and then if you need more additional support, please feel free to jump in. And we are also in the background working on kind of a list of consultants that are available to help folks with things. I'm going to say this right now, and we'll be very clear on this in the document when it's produced, that we're not going to be able to either endorse or, you know, promote anybody's individual work. We'll do our best in the background to make sure everybody's above board, but we're not going to be saying, like, these are consultants that have been endorsed by Big Tech or anything like that. And then I'm just going to give folks one more heads up to send in any additional questions because we're running towards the end of the questions we have, so if you have any additional ones, just send those in now. Is there a recommended number of managed care companies to contract with? You know, that's a really good question. So I think really this is going to come down to you about contracting with managed care companies who currently serve the clients that you have. You're definitely going to want to contract with all the managed care companies who serve the clients that you currently work with. You can go through the ePaces system. The eMedNey system can tell you where clients receive their managed care from for their physical health services, and that'll give you a good sense of where they're going to end up on the managed care side as well. But really, you're going to want to look to contract with the vast majority of managed care companies in your area, and actually they're going to be required to contract with you if a certain number of your clients are being served by them, or you're serving a certain number of their clients. On the adult side, it's 5. I don't know if it'll be any different on the kid side, but that information should be pretty much available very soon. And if you're serving, if you know your managed care company is serving your clients, then you definitely want to be contracted with them. Next one, regarding the emphasis on value-based services, my concern is that managed care may tend to only pay for interventions that work. In my experience, treatment professionals try to do different interventions until we find something that works in a value-based system. So, you know, this is a really valid concern, and I think it's something that we're going to have to be really mindful of. I think there will be, to your point, a emphasis on interventions that are evidence-based and based in evidence. I think the other thing that I would focus on is really it's going to be more about outcomes. I think, you know, we used to hang our shingle on the door and said we did this evidence-based practice, and I think that's still really important. But I think as a system, we're going to be moving more towards a system of I can produce these outcomes rather than I do this evidence-based practice. Now, you as an organization may find it valuable, and managed care will probably find it really valuable to get certified or to be able to say, like, we have staff who are trained and certified in these 7 evidence-based practices. And I think managed care is going to find that very critically important and may actually even pay you more money to provide services that are evidence-based. But I think the other thing that ultimately is going to be really important is what outcomes can you demonstrate with those practices. So I think it's a really important question and an important concern and something that we're really going to focus on as we move forward. Okay, let me just read ahead real quick, and then I'll come back and answer a couple more questions. So there's a question about the OMH Child Clinics billing foster care directly for mental health services. That is, we're going to take that one back and get a more formal answer on that. So we'll take that back. As the foster care per diem is changing, I know that foster care agencies that are going to bill managed care will bill managed care directly for services they provide. But how, when they contract out to like mental health clinics, how that's going to work, I need to take that back and get a more formal answer to that. I wouldn't want to put out the wrong information. Will there be any funds allocated for managed care readiness by the state? There have been in some areas, and there are likely to be in others. I don't want to say anything formally on that, but again, we'll take that back and get that out to folks as soon as we know. So if we don't bill Medicaid for our services, how might the managed care companies know we serve their covered lives? So it's about the individual. So the clients are already in managed care primarily for their physical health services, with some very small exceptions. So for the covered lives, they would just be carving in the additional mental health services that were carved out now into the existing work that they do with the clients on other things like primary care and those kinds of things. So that's how that works. So that's the list of questions I have. So I'll give people another couple of seconds if they want to chat anything else in, and we can answer that. And if not, we'll be able to wrap up everything and give people, you know, 4 or 5 minutes back to enjoy what looks like is turning into a beautiful afternoon, at least here in New York City. All right, so I'm not seeing any additional chat-ins, but I do just want to really thank everybody for taking the time today to join us for this. If you have other questions afterwards, please feel free to. Oh, we got one more question. Oh, so there's a question about national accreditation. So our understanding on the adult side is that it is likely to be that that OMH and OASAS certification or licensure is going to serve as what would usually be used as national credentialing for a credentialing process, and that will likely be carried over to the kids side. But when we get a little closer, we'll have more formal guidance on that. And then the last question is where again was the list of managed care contacts. If you go on our website, mictac.org, it is under the plan matrix, which is under tools and development, and I think it's actually on the scroll on the front of the screen as well. And you can also go directly to it at matrix.mictac.org. So with that, I don't see any additional questions, so I'll let folks enjoy the rest of their day, and I hope to be talking to you all soon as we start diving more deeply into the Children's Readiness Project. So thanks very much for taking the time to join today.